Hello and welcome to this comprehensive training on the INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test. My name is Lorna Gray and I'll be guiding you through this course. Today we'll begin with an essential introduction to the test, including an overview of HIV and syphilis, two of the most important public health challenges globally. This module will lay the foundation for your understanding, helping you to grasp the importance of accurate and rapid diagnosis in clinical settings. Let's get started. The INSTI Multiplex HIV-1, HIV-2 Syphilis Antibody Test is a state-of-the-art rapid flow-through immunoassay. It's designed to detect antibodies for both HIV-1, HIV-2 and Treponema pallidum, the bacteria responsible for syphilis, in human blood samples such as fingerstick blood, venous blood, plasma or serum. This test is revolutionary because it provides results in just 1 minute, offering healthcare professionals a powerful tool for quick and reliable diagnosis. It's specifically designed for use in point-of-care settings. Think emergency rooms, clinics and even field testing situations where immediate results are crucial. What makes the INSTI Multiplex test so effective is its simplicity and speed. The test involves a few straightforward steps: collecting the blood sample, adding it to the test solutions and interpreting the results. In as little as 1 minute, the test can determine if a patient has HIV, syphilis or both, allowing for immediate clinical action. To fully appreciate the importance of the INSTI Multiplex test, it's crucial to understand the basics of HIV. HIV, or human immunodeficiency virus, is a retrovirus that targets and gradually destroys the body's immune system, specifically the CD4 cells, which are a type of lymphocyte or white blood cell that plays a significant role in fighting infections. Once a person is infected with HIV, the virus can remain dormant for years. During this time, the individual may show no signs or symptoms. However, as the virus continues to replicate, it depletes the body's immune defences, leading to AIDS, or acquired immunodeficiency syndrome. At this final stage, the body becomes highly susceptible to opportunistic infections and certain cancers. HIV is a global pandemic, with an estimated 39.9 million people living with the virus worldwide. Sub-Saharan Africa is the most affected region, accounting for nearly 2/3 of all people living with HIV. Despite significant advancements in treatment, HIV remains a major public health issue. While there is no cure for HIV, antiretroviral therapy, or ART, has transformed HIV from a fatal disease to a manageable chronic condition. ART works by inhibiting the replication of the virus, allowing people to live longer, healthier lives. Importantly, when HIV-positive individuals maintain an undetectable viral load, thanks to ART, they cannot transmit the virus to others. This is the basis of the U=U campaign, which stands for undetectable equals untransmittable. HIV is transmitted through the exchange of certain bodily fluids, blood, semen, vaginal fluids, rectal fluids, and breast milk. High-risk behaviours such as having unprotected sex or sharing needles significantly increase the risk of transmission. Mother-to-child transmission can also occur during pregnancy, childbirth, or breastfeeding. Prevention strategies are vital in the fight against HIV. Consistent use of condoms during sexual activity and taking pre-exposure prophylaxis, or PrEP, are highly effective methods for reducing the risk of HIV infection. PrEP, when taken daily, can reduce the risk of acquiring HIV through sexual contact by about 99%. Now let's shift our focus to syphilis, a sexually transmitted infection caused by the bacterium Treponema pallidum. Syphilis is a potentially severe disease that progresses through distinct stages if left untreated, each with its own set of symptoms and complications. Syphilis infection begins with the primary stage, characterised by the appearance of one or more sores known as chancres. These are typically firm, round and painless, appearing at the location where the bacteria entered the body. Syphilis is highly contagious during this stage. If untreated, the infection progresses to the secondary stage, where it may cause a rash on the palms of the hands and the soles of the feet, along with other symptoms like mucous membrane lesions. These symptoms may resolve on their own, but without treatment, the disease will continue to advance. The latent stage can last for years, during which the disease is not contagious but still active within the body. If syphilis reaches the tertiary stage, it can lead to severe complications, including neurological damage, cardiovascular problems, and damage to other organs, such as the liver and bones. At this point, the disease can be life-threatening. The good news is that syphilis is curable with antibiotics, especially when detected in its early stages. Early diagnosis and treatment are crucial to prevent the progression to the more dangerous stages of the disease. This underscores the importance of regular testing, particularly for those at higher risk. The INSTI Multiplex Test is an essential tool in the early detection of HIV and syphilis. Traditional testing methods can take days to produce results, but the INSTI Multiplex Test delivers highly accurate results in just 1 minute. This speed is crucial in clinical settings where timely diagnosis can significantly impact patient outcomes. The test's simplicity also makes it ideal for point-of-care testing. It requires minimal training and can be performed in a variety of settings, from clinics and emergency rooms to mobile testing units. The rapid results allow for immediate clinical decisions, enabling healthcare providers to start treatment or take other necessary actions without delay. For patients, the speed and reliability of the INSTI Multiplex Test can make a significant difference. Quick diagnosis means faster access to treatment, reducing the likelihood of disease progression and preventing further transmission. As we've seen, the INSTI Multiplex Test is a powerful tool in the fight against HIV and syphilis. Its ability to deliver rapid and accurate results makes it indispensable in clinical practice. In the next module, we'll explore the test kit components in detail, providing you with the knowledge you need to perform the test correctly and confidently. Thank you for joining me in this introduction, and I look forward to seeing you in Module 2.